Good evening, everyone. My name is Brian Hanley, and your host for tonight's webinar on Rethink the Business of and Science of Hair Removal. I would like to welcome you to today's discussion. We have an informative presentation today with one of the laser industry's leading experts, Dr. Girish Munavali, a board-certified dermatologist and published author. I'm positive you will find today's event very informative and will make you rethink the business of hair removal. But before we get started, let me just take one quick moment to discuss how the webinar system is going to work this evening. There's a way to communicate with us, and it's in the bottom right corner. And if during the event you have some questions, please type it into the box, and at the end of the event we'll go through and then we will address all the questions all at the same time at the end. So with that done, your job now is just to sit back, listen, and enjoy the event. Now let me introduce our expert, Dr. Gili Munavali. Dr. Gili Munavali is a board-certified dermatologist. He's a graduate of the University of North Carolina at Chapel Hill, Johns Hopkins Bloomberg School of Public Health and Hygiene, Morehouse School of Medicine, Mayo Clinic, and the University of California, San Francisco. He has 2 years of fellowship training in Mohs surgery and reconstruction, laser surgery, and phlebotomy. He's the medical director for dermatology, laser, and vein specialist of the Carolinas in Charlotte, North Carolina, and the assistant professor of dermatology at Johns Hopkins School of Medicine. He's an author, co-author of over 50 peer-reviewed scientific articles and textbook chapters. He has 5 years' experience with vacuum-assisted devices for treatment of the skin. And with that, I'm going to hand over the reins to Dr. Munavali.
Okay, great. Thank you, Brian, for the introduction, and thanks to everybody for joining me tonight. I know everybody's in different time zones, and I appreciate some of you on the East Coast, like myself, staying a little late to listen. We'll try to keep it concise and go through some of the high points of, first, the more of the business aspects of why this could be a renaissance when it comes to hair removal in your practice. And then second, talk about some of the clinical results from the kind of most recent series of trials that we've been doing since late last year, so you can get a little bit more feel of what's been done with the duet, the high-speed handpiece specifically. So first, why hair removal? You might ask in this day and age of fillers. We do a lot of injectables in our office, and we do a lot of laser in our office. And we found, and hair removal has consistently been a top procedure. I've noticed in my own practice a personal erosion in North Carolina over the years, and I'll explain why that's been. But nationwide, it's still by far and away the most popular laser procedure done. Some of this data, according to the American Society, I think, of Plastic Surgery, looking at data from last year, it's second only to Botox in terms of volume of actual procedures, with obviously skewed heavily towards women, which makes sense. But you can see it here in the hierarchy of different treatments, and I think this kind of fits with my own personal practice. And in our it's different from state to state, but in North Carolina, there's not much of a restriction on who can do hair removal. So we've seen kind of over the past 10 years a boom in medi-spas and so forth. And so we've tried to look for a way to distinguish ourselves from other practices that do hair removal. And so this is where the brand name Light Shear really comes into play. I mean, everybody knows about the Light Shear no matter where you go, especially in this country, but even internationally. And it's considered to be a very well-established treatment for hair removal. The diode wavelength is a very well-studied wavelength for hair removal. And this kind of, what we'll say throughout the course of the evening really builds on that. This survey that was done earlier this year, and they said a practice survey from August, just mentions all the different brand names of devices that are out there. And the Light Shear is, again, very favorably compared with these other devices, other wavelengths, in terms of what's used and what's perceived and believed to be the best. So there's certainly a brand name recognition that goes with this. It's kind of hard to understate, and those of you who've been using a lot of fractionated devices and have had to explain, people coming in for certain brand name treatments such as the Fraxel that you have other devices that you might want to use can certainly sympathize with this kind of consumer push for a certain brand name. What about in terms of efficacy? Well, there have been numerous studies, almost too much to count, over the past 10 years in many different journals about the efficacy of hair removal. And it's really grouped around the wavelength of what wavelengths are used. The three big ones, diode, alexandrite, and ND-YAG, are ones that consistently come to the top with regards to efficacy and study in the literature. This was a study that was done back about 4 years ago now, I guess, by Dr. Goldman. He's also had quite a bit of experience with DUAD. And Dr. Rouse, I think was his fellow at the time, looking at clinical efficacy. Now, when I read studies on hair removal, I look long term. I look for 6, 8, 10 month, 12-month data, and I have kind of skeptical when I don't see that. And I know this is a study in progress. So in terms of efficacy, although you do see an improvement with the diode, favorably comparing with the alexandrite and much more favorable with the YAG, you would argue that it's still very early in the ball game. But what's also probably well known and well understood, but it was nice to show in the study, was the pain score. Because what we do in terms of hair removal, I think you can say is probably the single biggest factor that can affect the treatment, other than efficacy, is the tolerability in terms of pain. And so if you have a painful procedure, no matter how efficacious it is, you're going to have a hard time having people come back for treatments. And it makes sense if you just look at the length of the wavelength, the wavelength itself, and how deep it penetrates, that you get less pain with a shorter penetrating wavelength as you see. But it's hard kind of when you're looking at diode and alexandrite; they're so close together in terms of the size of the actual wavelengths that you would expect to see about similar pain scores. But you'd certainly expect to see less pain with that compared to a YAG, and that's what the study showed. So, and they used skin type 2 and then a good number of patients in the study. The next study we pulled out just to do like to see 12-month data, shows a comparison with the diode and the alexandrite lasers against long pulse alexandrite for treatment in a variety of skin types from 1 to 5. And we don't know the distribution. I don't have that with me in terms of the number of patients that were treated in each individual stratified by skin type. But this was done primarily in axilla, which we all know is a sun-protected area. So the follow-up, again, being 12 months, so very good efficacy with diode versus long pulse diodes for the permanent reduction or removal of hair. So that kind of sets the stage for what we have to follow. When you're rethinking the business of hair removal, I mean, it is a business. It's something you have to think about in terms of your overhead for the device, for where it's going to go, how much room it's going to take up, all the things that go into planning whether this is going to be a good money-making device for you. I think the first and foremost, you have to look at your patient population. First of all, are you getting requests from patients coming in your practice for hair removal? Is that something that you feel comfortable marketing in your practice? But also you have to look at what your patients are asking for and what they would prefer. And obviously, patients, all things being equal, efficacy being equal, pain tolerability is again at the top. So patients prefer treatments which don't hurt, plain and simple. And I think you'll see, why. I think we'll be able to explain why with this particular handpiece and some of the technology that's been worked into it, why it'd be less painful. And what ends up happening, and I mentioned this with fractionated lasers, but you could mention this with other lasers such as pulse light, is people will come in and ask for this technology by name. And I think in 8+ months I've been using this in my practice, as more and more patients get exposed to DUAD, they're coming in asking for it either because their friends had treatments in our office or it's getting out there and getting some more exposure. The other aspect of it, other than patients, is how your staff is going to handle the treatments themselves, because you want to develop a good flow. You want to have your staff to be very positive about the treatment and what it can do for hair removal, but you want to make sure that your staff can get patients in and out in a good amount of time. without lagging in any certain areas. It's not with the high-speed handpiece. The spot size is so large, the treatment time is really considerably reduced, and we actually have some good data showing how much reduction there is. And so the treatments themselves aren't as tedious, and they're not nearly as fatiguing to the staff that are doing them. In our office, I do some of the treatments. We have a registered nurse that has a lot of experience with the device that does some of the treatments, as well as even a medical assistant. Again, it varies depending on what state you live in, who can do the treatments or not. But when you're dealing with these treatments that are very repetitive and doing them day in, day out, your staff needs to be not only comfortable with the technology, but also comfortable with physically doing the treatments on patients. If there's, this particular handpiece, because there's less fluids delivered, there's not as much of a prep in terms of the application of topical anesthetics. In fact, with the high-speed handpiece, anesthetic pre-treatment is not required. So you can see how that would have advantages in terms of transporting patients into a treatment room, doing the treatment without waiting, and then getting patients back to their day. So you get benefits there. One thing I've found also, that patients who are interested in hair removal and even would like to consider having hair removal on the day of consults, that's a patient population that I typically had to reschedule, and I don't always have to do that now because we have one of the providers able and has a time in their schedule to treat it. We can go right into treatment after doing the consent without having to worry about doing any type of pre-treatment application of anesthetics. So, divide it up into the patient benefits and the practice benefits, and here's a summary slide to show that. And I guess what I try to focus on is trying to differentiate my practice, because in our state, there are a lot, and if you listen to the radio in the morning, there are so many ads on laser treatments and specifically laser hair removal. So you really need to distinguish how your practice is different. And we distinguish our practice by our experience and expertise, but we also distinguish it now by the availability of this device for hair removal. So why is it so different? What are the advantages, and what are the technology advances in this that's made it different? And those of you who have used the light shear for years and years know that there's kind of an evolution from the ET to the XC, and there's increase in the spot size as well as an increase in some flexibility with parameters. And now you can see with the high speed, especially looking at the left in comparison with the other two, the dramatically increased spot size. And really, when you talk about hair removal, spot size, talk about what your device can do. Spot size is always the first question people will ask. And what's the cooling? Those are probably the biggest questions that get asked. And looking at the picture here, you can see, you get a really good visual of how big this spot size is. At 35 by 22, you can cover a lot of surface area. It's in fact the largest spot of any diode that's currently available. And again, with the vacuum apparatus that's included in the handpiece, and I'll show you a schematic of that next, no topical is required because the fluences that are required to treat are orders of magnitude less than what you would normally use. So when you increase the spot size, direct benefit of that obviously is you're decreasing the number of pulses per treated site, so your treatment time is less. And this table shows you how you can decrease. It gives you a hands-on kind of a feel for how many pulses you can get away with in certain treatment areas. And you can look and see with areas such as the bikini area, it's a dramatic difference in the number of pulses compared with the original ET spot size. And then you look at different areas, specifically the male back, which anybody who's done those knows how tedious and monotonous this treatments can be. It's just a dramatic 100-fold decrease in the number of pulses. So, in fact, our treatments times for the back, male back, and these are larger males, 6 foot or bigger, 6'2", 6'3", wasn't any more than, say, 25 to 30 minutes at maximum. Whereas before that would be unheard of. So this gives you a good idea of how much the spot size can help you to increase decrease your treatment time. And then looking at this table again, this is some data that was provided by some of the early adopters the technology and the market preference evaluation study, looking at specifically by treatment area, and then again the time before and after the implementation of the high-speed handpiece. You get a reduction almost of upwards of two-thirds, of almost 66% reduction in time from the largest areas being the back to even smaller areas in the axilla and the bikini area. So this can't be overstated, as your staff can save more time, your patients don't have to spend as much time undergoing the treatment, and you can treat more patients in a given day. So what is the advance along with the spot size that makes the difference? The vacuum really is the big one, and I have had a lot of experience with vacuum-assisted handpieces over the years. There are vacuum-assisted handpieces that have a pulse light source working with them, and those have become initially started out as treatment for hair removal, and they did show earlier studies did show that again there was a reduction in the pain tolerability with vacuum-assisted devices, in addition to other applications in terms of acne and so forth. So I've had a lot of experience with it, and I know that it's definitely an innovation that has made a difference. And there have been a lot of innovations over the years in using lasers, but the application of vacuum concurrent with laser and light sources has really made a difference. And in this particular case, you can see clearly the spot size is bigger. Because you can, if you look at the bottom graphic, because when you activate the vacuum, you have to achieve vacuum before the device will fire. You're actually, in effect, doing several things. And for those of you who have used vacuum, I apologize for kind of this being a little basic, but I think it's important to understand conceptually, because there are a lot of us out here that have not used vacuum in association with the light device. But by pulling the surface and you can modulate the vacuum, by the way. You can go low, medium, and high. You pull the skin up into the handpiece. That in fact stretches the skin, which decreases the effective melanin concentration by spreading out that melanin to the epidermis. It blanches the skin because the blood vessels that are in that treatment area that have been this pressure has been applied to constrict, and so the hemoglobin, oxyhemoglobin, gets blanched out of that area. So it drops the effect of another chromophore in the area, and then it takes all those dermal targets. And in this case, we're talking about the hair bulb. Previous years, I've been talking about sebaceous glands for acne, but in this case, definitely the hair bulb effectively gets moved closer to the light source, moving from mid to low dermis up into the high dermis, so it becomes much more exposed. The other thing is you can see that since the light is coming from all different sources, there's a reflector in there, that gold color, that's actually a reflector. Light's hitting this from several different directions. So this light in the form of photons are hitting from the top and hitting from the sides both. So you're getting exposure to the hair bulb, which in the melanin in the hair bulb, which is the target in this case, for multiple different directions. And that's important, and I think that's just part of the reason why fluence can be so low, yet get such a high efficacy with this device. Why do we know this? We've done clinical work, and we'll show you the pictures, and I think there's equivalence there that you'll agree with. But from a scientific standpoint, there's been some recent work that I've reviewed very recently from a group at UC Riverside that does a lot of modeling, and actually had the opportunity to visit their lab and see what they did in previous months. But they actually do a lot of their work on computer modeling, so they'll model the hair and the dermis at a given depth, and they'll model the energy source, and they'll look and see and try to answer the question that we all want to know is, regardless of the light source or laser source, exactly how much energy is getting in the bulb and how high is the temperature getting. They commented on some of the reasons why the ET and the HS handpiece are equally efficacious, despite the reduction in fluence in the HS handpiece. One, the first comment they made was based on the gold coating, and I'm going to do a little navigation here and go back a couple slides to let you see a picture of the handpiece again, because you might have overlooked this. But if you look at the reflector, you can see inside the handpiece, and you can see the array here where you're going to get the laser light, the laser emitted from that coherent light source. Then you look out and you see this gold color. This, in fact, is a gold reflector that concentrates the light and the laser and keeps these photons pointing into the skin. So you're in fact getting an increase in the number of photons that are being delivered to the target area. So they commented that gold coating does reduce the light loss due from reflections. Remember, you're going from one media to the other, so anytime you're doing that, some of these laser and light sources some of that energy will be reflected from the skin surface. Think back to that spotlight again. It's a much wider spot that allows you for a wider beam, and that also increases the number of photons that are launched by decreasing the amount of what we call scatter of these different photons going into the dermis. So again, it makes similar fluences be more effective for delivering the energy to the target area. And the vacuum suction, which changes the skin geometry from a flat to a bulged surface. You can imagine that skin coming up and going right into the vacuum-assisted area where the light, where the laser is, energy is irradiated and that stuff. So it allows hair follicles to be subjected to radiation from different directions. These are some schematics from some of the work they did. So the bulging geometry, which you see on top, and this gives you a visual. If you're looking at a skin surface, which is normally flat, and you're bringing the skin up in a bulging fashion, you can imagine that light can not only hit it from above, but laterally or circumferentially around that, and it can focus in the middle where the bulbs are. And looking at figure 10, from some of the work they did with this model, this is temperature distribution immediately after a laser pulse. And the fluences given here are 11 joules per centimeter squared, 55 milliseconds for the HS handpiece, with bulging and without bulging. So with the bulging effect, and you're looking at figure B here, or B in figure 10, I'll point to it with the pointer, you can see that with bulging, you're able to achieve higher temperatures. If you're looking at this gauge on your right, and you remember that you want the critical temperature for any follicle really is you want to try to achieve a temperature in the range of 80 degrees C, because that will destroy the hair. And so you can see you're able to achieve these temperatures and some of these simulated modeled hairs by bulging and getting that skin up into the handpiece where it can be hit with more photons. And then this diagram also shows, in comparison to the ET values, and most of us know the ET and are comfortable with the amount of energy we're getting out of the handpiece. So they looked at a comparison with 30 joules per centimeter squared and a 15 millisecond pulse duration for the ET, and compared with the HS at 11 joules and 55 milliseconds. Taking into account some other factors, there's less reflective loss because we talked about the presence of that gold reflector. The beam obviously is bigger, so it's able to focus the photons more, pulse duration being different, but the consideration of vacuum suction here and that bulging effect. And you can achieve at a third of the fluence, heating of the follicles to that critical temperature with the HS handpiece. So what does this mean? This explains why, in my mind, in this model, why you can get equivalent fluences with a handpiece that's emitting a third of the, equivalent efficacy with a handpiece that's emitting a third of the fluence for a given treatment area. You're able to achieve that 80% target temperature in the bulb, and that's all you need to do. So some of this work is actually very interesting to look at. I know they will apply these models first before we take them out into the field to make sure that we're able to achieve that target temperature. Some of the other conclusions they came to when they wanted to look at they wanted to make sure what wasn't happening and if there's a difference in the efficacy between these two. Was there any way to rule out impact due to the presence of some of these other factors here? I'll go through these now. So I looked at the orientation of the hair, because if you think about it, if your hair is oriented not perpendicularly but in a skewed or oblique fashion, could it be that one hairs are getting heated in a preferential fashion in that direction? And that turned out not to be the case with the modeling. They looked at the impact of the gold reflective coating, if that was some kind of difference. But they really noted, again, as we just showed you, less fluence was needed because there's less reflection loss in the HS handpiece. So that was the difference there. And then in terms of cooling, the HS handpiece does not have an active cooling system. So you might argue that maybe that plays a role in it. In fact, there was no impact due to lack of an active cooling system. Because we're using fluences that are much less, cooling is not required either in active cooling or evaporative cooling, as you see with some other vacuum-assisted handpieces on the market. And tolerability is still very good, and efficacy is still very good, and the epidermis still maintains a temperature in the safe zone. So when without the need for cooling, it really impacts your treatment a lot because you don't have to use topical anesthetics, and heat doesn't build up to damage. You don't have to worry about cooling to keep heat from damaging the epidermis. So some of these multiple factors which contribute to comfort, I'll summarize here: the larger spot size, the enhanced absorption allows for lower fluences, and the vacuum sensation, which I know from my own personal experience in talking to patients, almost makes them feel like they can't pinpoint the exact area where the laser is firing because they're feeling a sensation of pull from an entire area, and possibly overwhelming the receptors in that area and giving them this gate theory where they can't really tell what receptor's firing, whether it be pain, pressure, or whatever, so they just don't feel anything. Or, in fact, maybe all of them are firing, and so the sensation of pain is overwhelmed, so they don't feel anything. But regardless of that, you don't need a topical anesthetic for normal fluences that are used for type 1 to type 4 skin. So it cuts down on the overhead. Obviously, it saves staff time and room time. You don't need to place these patients while they're getting absorption of the numbing cream, and it increases the safety because you don't have to apply a topical anesthetic to large surface areas. And being in North Carolina, I can't escape that fact that we had, I want to say it was now 5 or 6 years ago, that we had a controversy with one of the practice in the state capitol that was applying topical anesthetic to over 30%, to one or two legs at a time and occluding it, and we had unfortunately had 2 fatalities as a result of that. So people are acutely aware of the need to regulate how much body surface area topical anesthetic is applied to. You don't, because of the configuration of the handpiece and the low fluence, you don't need icing and active cooling to achieve pain relief. I'll make one exception in terms of where I might go from one handpiece to the other. That you remember the ET handpiece does have active cooling through a sapphire tip. Is one of over bony areas where it may be difficult to achieve suction because you have to be able to pull in some skin to achieve suction before it will fire. So in those cases, and in fact, in my own mind, I'd like to have some additional cooling because I think you can get some reflection off of the bone of these deeper penetrating wavelengths. So pretibular area, spine, dorsal foot, I probably would switch to the ET handpiece to not only do a faster treatment, not without worrying about achieving suction, but also keep the epidermis cool and keep the patients comfortable. I was alluding earlier to a market preference evaluation, which has been ongoing since late last year. In this evaluation, 6 sites with over 175 treatments have been done, and this is in sites not just in the U.S. but worldwide, with a total of over 50 patients treated, evenly distributed throughout these sites. So it's important because we've had different investigators had a chance to work with the device and apply their own level of expertise to see how they like it and how it works in their hands. All the major body parts have been treated. Just reviewing some of the looking at some of the study data, and at least in our practice, I know that legs, back, underarms, bikini area were all treated with HS handpiece. What they found, and the data is still coming in, by the way, but what we found so far is that 80% of the subjects preferred the HS handpiece over the ET handpiece, and greater than 90% of them were satisfied with their treatments. More than 85% of these subjects would seek an HS treatment. Again, this is all directly related to the comfort of the treatment and the efficacy of the treatment. And over 90% would recommend to a friend. So going back to where you're trying to establish yourself or reestablish yourself, in my case, in a marketplace where this particular laser treatment is still very popular and a very viable strategy for boosting your practice revenue, it's important to have patients talking to other patients and other potential patients about the treatments that they had. The Duet is LightSure is a very recognizable name, and they know Duet, and they know that it's a relatively painless treatment. So let's go to looking at some of the clinical photos to finish up, and we'll talk about settings, and then we'll take questions. This was one of the sites. In fact, this is Dr. Goldman's. He's one of the sites. This is his own back, his own personal photograph showing the improvement after just 2 treatments. And this is something that I've seen as well. The high-speed handpiece makes this type of a treatment surface area a very viable option. They noted that 15 to 20 minutes was really all that was required to treat his back. Vacuum settings and pulses can be modulated as well as the pulse width, and these are the settings that they used for treatment of his back. So I can imagine, and typically we like to do obviously 4 to 6 treatments in our treatment course spaced about 6 weeks apart. I would just imagine these results getting better and better. This was from an investigator in Israel, Dr. Lapidot, who's very well known in the laser world. This is again after treatment number 5, 3 months after using the high-speed handpiece. This hair is a very good target, and these are some of the fluences that were used for skin type 3, and again, a very good response. These are some of my treatments from our subjects that were treated, and I'm picking some of the ones I think would be most representative of what we saw in the study. So this is a young girl's forearm. You can see very fair-skinned and very fine hair. This is not coarse, and it's definitely not dark. This was a pre-treatment photograph of the right arm. Now, with the ET, probably this is a post-5 treatment. This probably shouldn't surprise you. This is the ET handpiece, and the settings are listed below. A really nice response to treatment, and she's thrilled with the result here. Again, but looking at the other hand, which had the same degree of hair on it, this is post-5 treatments with the HS handpiece, which she preferred. Treatments were much faster and much more comfortable because these lower energies. Look at the joules that were used. Only 10 to 12 joules per centimeter squared were required, and you can see the pulse width used here, 30 milliseconds to custom depending. And again, a really nice clearance after 5 treatments. What makes the difference? This is a question we get asked a lot, and I put this slide in to show you. This is a patient being treated for what is really about its coarse, medium brown hair on the lower extremities, and this is right after the treatment. And she didn't have this reaction once. She had this reaction after every single treatment, and she had 5 treatments. If you look at the label on her right side was the HS handpiece, and on the left side was the ET handpiece. And look at the difference in the immediate reaction. You would expect to see some sort of perifollicular edema and erythema in the ET handpiece, because that's what we're used to, and that's what we typically call a good clinical endpoint. But we're really redefining the endpoints with this HS handpiece, and this is something that I think that users and potential buyers need to get comfortable with. Is you may not see this perifollicular edema and erythema that you're used to, but you'll still can see the same clinical results. This patient got a very good result after 5 treatments, but I put this in to show you that you don't always get that reaction with the HS handpiece, and that's not something that should worry you. And I think just continuing the course of treatments showed me personally that we can still achieve the efficacy without seeing that reaction. I thought this was a nice example to show. This is before and after baseline with the HS handpiece. Again, you can cover this area very quickly. Granted, this is a very good coarse dark hair to treat. As you would expect this to respond well. After 8 months post 6 treatments, you get a really nice response. This is a little tougher treatment, not as dark, but still mild to moderate coarsity of the hair. But after six treatments with the HS handpiece, and again, you're talking about not more than 10 pulses to treat this entire axilla. She got a very nice response. This is type 3. She's of Peruvian descent. You want to be kind of careful with darker skin types, or anybody with some ethnicity and darker hair, darker eyes, to be sure how they respond because of the sun protected area. But before treatment and after treatment, you see a really nice. This was 8 months post-treatment. One with the high-speed handpiece, and really nice improvement in the hair compared to baseline. And I just took these pictures recently to show you that with 5 months to compare, and it's almost a split area study between the HS and the ET handpiece. And you can see the labeling for yourself. They're very comparable in terms of their efficacy, and again, tolerability, pain tolerability being much more skewed towards the HS handpiece. But in terms of efficacy, all things being equal, you can get a very equivalent result with much less fluence and much less treatment time. We'll end with some treatment parameters. I'm sure there's some questions. We can refer back to this. And these treatment parameters, which will be distributed at some point in the near future, are a compilation of several of the investigators' their experience with subjects treated during this market preference trial, and starting with skin types 1 and then working up to skin types 5 and 6, which we didn't see a lot of those darker skin types in the trial, but we can run through these. And again, these are nice because they're broken down by hair color and then by hair texture. So you get a really good starting point of your treatment parameters. I won't go through each of these, but we can discuss these. Types 3 and types 4, again, are looking at the starting fluences. These are all, again, for the HS handpiece. Starting fluences and the pulse duration and the number of pulses. Remember that you can modulate the vacuum and the number of pulses. So you can get a single, double, or triple pulse with this device. And you can go low, medium, or high in the vacuum with this device. And we'll probably get some questions as to when you would do that. So you've got a lot of flexibility, in addition to being able to body modulate the pulse duration. And this last slide shows for type 5 and type 6. And I know from my own personal experience, I don't have a lot of patients with this skin type that are requesting hair removal in our practice. And with type 6 is involved, I do tend to feel more comfortable using longer wavelengths to treat because of the darkness of the skin. So we'll end there. I want to thank everybody for their attention, and we'll take some questions. And we're fortunate, really fortunate, and I personally appreciate Dr. Dora Gilbert being on the call. I know he's a busy day like myself and probably has a lot of things to do, but I really appreciate him being on the call because he has a ton of experience with lasers and a lot of experience with this device, and he's going to really, it's kind of a treat. He'll be available to help answer questions with me that we have gotten accumulated during the course of the webinar. Just for reference, there are 2 links to more information about the device itself, and also how the device compares in terms of a real-time speed for the video with other laser technologies such as long pulse Alex. So I think I'll turn it back over to Brian, our moderator, and have him walk through some of the questions. And I appreciate your attention.
Thank you, Dr. Munavali, for your presentation, and welcome again, Dr. Gilbert. The first question that came through was basically on efficacy. Efficacy is my biggest worry with this HS handpiece. Have you studied the long-term over 1-year efficacy of the HS Duet handpiece side by side with an Alexandrite laser on types 1, 2, and 3 skin, or with a YAG laser on darker skin types?
I think you've hit the $64,000 question. In our office, we started treating with this handpiece in January. So all the follow-up we have is from the treatment, from a 5 or 6 treatment regimen that started in January. We do have patients that have gone 4.5 months since their last official treatment without any hair growth, and that's after a series of treatments. I do realize the gold standard being really you need to look at 1-year data, and also you want to compare it to other wavelengths. We were fortunate we were able to compare it with a known wavelength, with the classic ET handpiece, and I think what we did show is in my mind, anyway, there's equal efficacy between the two handpieces in terms of what they do. So I feel comfortable answering that question. Now, with regards to comparison with other wavelengths, we have not gotten that far yet. I assume that will be done as this technology gets more advanced. And as we continue to get follow-up on our patients and out to a year, we'll make that available. I know Dr. Gilbert's on the call, so feel free to comment on that, Dory, if you would.
Sure. Well, we've had a similar experience as you. We've had the laser about the same amount of time. And prior to that, we've used the ET, and we've used that for many, many years with great results. So my biggest concern was how well would the efficacy match up to the ET. Just because it was bigger and faster, it had to be as good. Otherwise, it wasn't worth it. And what we have found in our follow-up, which is about the same, is that we're finding similar efficacy compared to the ET. We don't use the Alexandrite or the YAG laser for hair removal, so I can't compare them. But that would be an interesting study if someone out there had, multiple lasers for hair removal.
We have basically all wavelengths. We've used IPL, which we don't use much for hair, long pulse, Alex, and YAG, and I'm finding this one to certainly be more comfortable than those other two. And in terms of efficacy, I look forward to a comparison with. I think really the other choice, the long pulse Alex, is probably the other one that people might consider for types 1 through 4 to be a gold standard. So I look forward to seeing that as well. But I'm just really impressed with the tolerability in what I've seen so far in our practice.
Okay, the second question comes in. It's, do you still follow the telogen phase for spacing of treatments?
Yes, with this, with the HS handpiece, still everything it still follows as before in terms of where on the body you are and how you cycle your treatments based on, treating. You obviously want to treat the growth phase, so it really depends on where you are. I don't change anything about that. I don't change any of the number of treatments. You might it depends on on every individual practitioner how they do it, but I really haven't had to change anything. Dr. Gilbert, do you have any comments on that?
Neither have we. We're 4 weeks on the face, 6 weeks in the bikini next, so 6 to 8 weeks on the legs, probably 6 weeks on the back. That's how we start. And then I tell patients, as we get into the third and fourth treatment, you'll have a really good idea of what your cycle really is. So, that may adjust by a week or two in either direction, depending on the individual patient, but we start out with the same sorts of telogen phase spacing.
Dr. Gilman, if you could just speak up a little bit louder going forward, that'd be great.
Sure.
Thank you. The next question is, do you need to increase the pulse time custom with HS because of less fluence?
We can go back and look at some of these numbers here. I mean, let's pick a skin type. I'll usually use custom 30 or auto typically for my settings. I have not found that I particularly need to increase the pulse time. What I might do is you can actually change the number of pulses. So I've kind of been experimenting a little bit with a double pulse, especially for finer hair. I don't use that routinely, but that's one way to do it. Again, you can go, I start with moderate fluences, as you can see here, depending on the coarseness of the hair and move my way out. But I've, using these parameters that you can see, I've been pretty comfortable with what settings we've been able to achieve. And I'm a pretty conservative guy when it comes to treatment. Dr. Gilbert, do you have any comments on that? Or?
Sure. Really the time we change our pulse durations, apart from these clinical recommendations, is if patient has a darker skin type, and then we're going to increase our pulse durations. But for the most part, we adhere to what you see in front of you. And we're getting more aggressive as we go along because we really haven't had really any problems with the device. And so when I say more aggressive, we also have been experimenting with the double pulses on lighter skin patients, and we're finding that the lighter skin types 2 and light 3s tolerate the double pulses pretty well, and I think we get a better result, whether it's fine hair or coarser hair.
Okay. With that said, what are the clinical endpoints when you have hair that is no longer coarse or dense and it's starting to get thinner?
Yeah, I'm going to go back to show you that. Picture if I can find it. I mean, yeah, it's a good question. I mean, really, I think you have to think about it as redefining what your endpoints are. And my disclaimer is that I think that permanent hair reduction permanent hair removal is almost a misnomer. I'm more of a believer of permanent hair reduction, and that means in number, but it also means reduction in diameter of the follicle and quality and texture of the hair. Achieving more of a thin, faint colored hair, I think, is actually a good endpoint. And I'm also a believer in maintenance treatments. I think hair doesn't get wiped out completely, and I think it needs to have maintenance treatments to really maintain your good results. But as the target gets smaller, obviously, what little reaction there is becomes less and less noticeable. So it's kind of hard to see. I mean, I remember first starting with YAG lasers and getting kind of a gratification out of the hair popping with darker hair, and I know that I got it. I know it was a good endpoint, and I didn't get folliculitis afterwards in some patients in those areas because the hair was gone in terms of trapped hair follicles and so forth. But what you see here with the ET handpiece still holds true with the Duet. And keep in mind that the Duet is not just the HS handpiece. I use both of them during treatments. Obviously, there's areas on the face where the lip and the sideburn and the chin and all that where the HS handpiece is not going to be an option due to the treatment area and the treatment contour. So the ET handpiece is something you still have as an option and can use frequently. But when it comes to the HS handpiece, it's more difficult, and I have found that just stay the course with the treatments, and I've been surprised that the course of 4 to 6 treatments that
Oh, it looks like we've lost Dr. Munavali's his connection.
Okay, I'm still on.
Dr. Dory, can you answer that question?
Well, the last question I heard was, what's the endpoint?
Yeah, what's the clinical endpoint when you start to get thinner hair?
Well, it's different between the two. With the light shear, you do see that follicular erythema, but with the high speed, you see generalized erythema, but you don't see as much of the follicular erythema that you saw with just the ET itself. So I think maybe some of that erythema is from the suction and, of course, from the light, but we don't have the post-op follicular edema like we did with the ET, but the results are similar. So I think that I don't think that's a problem, and you just kind of get used to that as you go along. And again, you just have to kind of have faith because it's a new paradigm now that when you're using the HS handpiece. Do you want me to answer the?
I'm back. Sorry, but I got dropped. Yeah.
Anyway, I was just talking about saying the same thing that you did about we don't see as much follicular edema or perifollicular edema with the HS as we do with the ET. So we do see erythema from the I think from the suction in some people.
Okay. Trying to find the next question here. It says, how and when do you increase fluence? What do you do when you're at max fluence of 12 joules? Do you go to double pulse? Or do you go from a single pulse to a double pulse? Do you need to reduce the fluence? It's kind of a mixture of a couple questions there. Dr. Gilbert, can you answer this one?
Sure. Well, we usually start off with single pulses on most patients, and we push the energy to what they can tolerate, and in this case they can usually tolerate a lot because this is a pretty painless procedure to do. So we're usually up around 11 to 12 joules with most patients in our treatments. We've had some patients who we've been able to double pulse without any problems at all. And like I said, those are the lighter skin patients with type 2 and light 3s. So when we find that they can tolerate the double pulse, then we will use that because I think we get a little bit better results. But you've got to be careful with the double pulse, especially if you're using 11 joules. When you're just starting out, you may want to drop down to 8 or 9 when you first get the device until you're comfortable with it, and you develop. You know what the patients can tolerate. They'll tell you, and so you'll know as you go along where you're at, just like with the ET.
Yeah, I'm back again. Sorry, but the same thing applies to the vacuum as well. As we get, I think to take advantage of the vacuum, I think a medium is a good setting. Obviously, if they're not comfortable, you can drop to low. But we were discussing earlier about maybe compromising speed by doing medium and be switching to low to go a little faster. But I think that doesn't take full advantage of the vacuum. I think the vacuum's a big component of this. So I try to stay at whatever's tolerable for patients, and if medium or if medium vacuum is tolerable, then I'll stick with that.
Yeah, and we almost always are on medium. Rarely do we ever go to low. Most patients can tolerate that.
And Dr. Munavali, when do you increase fluence as far as when you get to the max energy? Would you drop the energy and then double pulse?
Yeah, again, we're experimenting with double pulsing, especially in lighter skin types. The whole purpose of double pulsing, obviously, is to try to increase the energy delivered to the bulb while safely maintaining a safe target temperature in the epidermis, and so giving a little bit of a gap in between the pulses. I think, and I think it also helps for some degree for comfort. But I'm looking at the different variables. Looking at the coarseness of the hair. I think if it's more coarse, I'll usually tend to, I'll reach a point at 12 joules where I may try double pulsing depending on the quality of the hair. And sometimes I'll vary it from treatment to treatment. Sometimes I'll do a double pulse on one treatment, and the next treatment I'll come back and increase the fluence a little bit more. It kind of depends, but it's really nice to have that flexibility. I'm only used to having that flexibility with pulse-like devices, and so it's great to have it for a diode device like this.
Well, I think if you're treating a patient and the patient's having really good results and they're coming back for their second, third treatments, there's no reason to push it. But if you have a patient who seems to be a little resistant, or they have finer hair now, and you need to get a little bit more energy in, then I think that's when I would go to the double pulse, and then you might decrease your energy just a little bit to start with.
Okay. We have a couple of questions that are starting to ask about skin types 4 and 5. It says, with darker skin types, how do you wait? How long do you wait during the test areas? How many pulses do you do? And when you're doing a test area on darker, how many pulses do you do when you're doing a test area?
Well, I try to pick an area. Obviously, I want to make sure that they're not dark skin type and have some sun exposure. I like to pick an area that's not centrally located, something that's kind of off to the side. And I also really like to gauge their level of tolerability. So I may do keep in mind the HS handpiece is a big spot, so you can cover a lot of ground quickly. I may do 2-3 pulses and just sit and wait and watch. I'm just going to ask them how they feel, because that's important to me. If it's uncomfortable, that's a warning sign to turn down the energy regardless of what your starting parameters may be. It really has to go by what they feel. And then just wait. And with the HS handpiece, it's a little different again because you may or may not see some of those classic signs. In fact, often you won't see them. So you have to know that you don't want to keep over-pulsing an area because you think that you're not getting the signs that you need, and it's not, in a sense, you're under-treating the area. Well, that's really not the case with this.
We're very conservative, and so if we have a patient with who's a dark 4, we'll do a test site and we'll make them wait 24 hours before we'll treat them. Anything dark 4 and over, because there are some patients that do have delayed reactions with the darker skin types. If they're a lighter 4, then we'll do a test spot and we'll wait a few minutes and see what kind of a reaction they have. Skin types 1, 2, and 3, we don't generally test.
Okay.
Yeah, I think erythema should definitely be your guide as well. If you're seeing any significant erythema, you got to keep that in mind, and that's a warning sign as well.
And do you often get polyfollicular erythema with darker skin patients?
Again, it really depends on on what the handpiece you're using. For the ET, yeah, I've certainly seen that. At 100 milliseconds, I've seen it. At 400 milliseconds, I've seen it some. But with this, not really. I mean, I still, and for me, it's actually sometimes difficult to appreciate erythema in darker, especially darker 4s and 5s. Sometimes you have to look real close to see it. But I think it's a great suggestion to wait. If you're at all concerned, to wait over, and don't do it that day. Just wait it out and come back and see, and then ask the patient how long did the redness last. I think that's important as well.
Yeah, you can always add more salt to the soup, and that's kind of how we do everything. Whether it's we're doing the Lume 1 or we're doing hair removal, we always have that in the back of our mind because, like I said, you can always add more salt to the soup. You don't want to burn somebody.
And we got one more question here. It says, so when do you double pulse versus shorten the pulse width? Is there any rule of thumb on that you guys follow?
We've kind of recently been experimenting with double pulsing them. I think, again, the comments we made earlier, if you start to reach a plateau, that might be a good time to do it. If you're starting to see some non-responsiveness, you can consider going to double pulsing. In our practice anyway, we're just beginning to experiment more with that. We have not done any triple pulsing. I don't know if that's necessary. And it certainly is a little bit more difficult to tolerate for the patients.
Yeah, I agree with everything you just said.
Well, that's the last question. So thank you, Dr. Munavala and Dr. Gilbert, for sharing your experience and expertise with the high-speed Leisure Duet and laser hair removal with everyone in attendance this evening. I'm sure that your presentation has most of the people rethinking the business of hair removal.
Okay, thank you.
If you'd like to view this event again, you can log on to www.luminous.com/webinars for access to the webinar archive. You can view this and previous events right from your computer. Stay tuned for more educational announcements from Luminous. Please take a few minutes to fill out the brief questionnaire at the close of this webinar. This feedback will help us design future events that best meet your needs. If you would like more information about the Leisure Duet, simply indicate your interest at the end of the poll. And that wraps it up for tonight. Thank you, everyone, and have a good night.